unknown pathogen is affecting so many dogs across the country right now, and it's causing a lot of worry, a lot of concern for pet owners. So joining us now in studio is Dr. Sam Varon, owner of Broadway Veterinary Hospital here in Sacramento, here to explain what they know so far and how we can best treat our dog if they do come sick with this. Thank you so much, Doctor, for joining us this morning and bringing in this sweet little baby again.
Hello, Autumn.
Autumn. Okay, so what do we know about this? Is it a bacteria or is it a virus?
Well, I think that we suspect it might be a virus or some mutated bacteria. It's something that we're really not sure of yet because not enough testing has been going on. Most people, when their dog's sick, if their test is not really going to make too big of a difference and the dog is going to do fine, they're not going to want to spend the extra money on a test. So there's little pockets of these unique looking pathogens popping up, but we don't really have any consistent data yet to be able to make a decision as far as what it is. Most of the time they are responding to treatment though, supportive care, just like any kennel cough. So it's not something that we need to be, be so afraid to do anything, but I think it is important to be more cognizant over the holidays and probably not board your dogs and make sure they are vaccinated for kennel cough.
Go to a dog park, or
yeah,
are having a holiday party, you probably want to keep the dog separate.
Exactly.
So and a lot of things that are happening with this specifically is when they get tested, it comes back with negative test results, and that's what the mystery is with this, right? You just really don't know what it is or where it's originating from, right? We don't know where's that.
Not really, and canine flu, CIV, there could be different serovars of it, there could be different mutations of it, and we vaccinate for canine flu. And then the other one that we vaccinate for is Bordetella or kennel cough, which is a bacteria. Mycoplasma is another one that gets secondary bacterial infections. I think that they mentioned Mycoplasma, they found Mycoplasma genes in one of the studies, so there could be some sort of mutation of a bacteria involved.
So there was one article that came out recently, it was Fox News article. This couple in California had a golden retriever that got sick with this, but they used a medication that's used to treat human conjunctivitis, and they used it on the dog. The dog was cured, like it was fine after that. Now, when we hear that using human medications on dogs is probably not recommended, but in this circumstance, would it work? Well,
I mean, we use most of the medications we use are the same in people as in animals, but it's our job as veterinarians to make sure we reserve those really potent antibiotics for the human. Because the problem is that if we use them all the time, then we get resistance, and if we get resistance, then we can't really fight those really bad infections.
In the meantime, if your dog is coughing, malaise, you said, fever, take them in right away, right?
No, not even just take them in, right? So most of the time when we see these symptoms, it sounds like something stuck in my dog's throat, honking cough, with terminal retch, so they were kind of really retch at the end of it. It's pretty characteristic of kennel cough. We send them home with doxycycline, which is an antibiotic that targets pathogens for the upper respiratory tract, and then we also give them cough suppressants.
Okay.
But at the same time, unless the pets are really, lots of mucus coming from the nose, and we suspect that there's a major bacterial pneumonia.
That's when,
yeah. So if they're progressing despite treatment, that's when we really, after a few days, they're getting worse.
Okay.
Yeah.
Dr. Varon, thank you so much.
You're welcome.
Coming in and bringing in Autumn. We always love seeing her, and we always love hearing your advice for pet owners at home.